What if one of the most dangerous blood pressure problems after 60 was happening while you were asleep, and you had no idea? That is the part many older adults never get told. You can feel fine, go to bed on time, wake up thinking you slept well enough, and still miss a silent pattern that may put extra strain on your heart, brain, kidneys, and blood vessels. No dramatic warning, no obvious symptoms, just pressure building quietly while everything seems normal. I'm Dr. Nolan Ashford, and today I want to talk with you about a hidden blood pressure issue that often gets overlooked in adults over 60. What your blood pressure may be doing at night. Most people assume high blood pressure should make them feel bad, a headache, dizziness, pressure in the face. But often, high blood pressure stays silent. That is one reason it can be so serious. You may feel normal while your body is under more strain than you realize. Most treatment decisions are based on one blood pressure reading taken in the clinic. That reading matters, but it is only a snapshot of one moment. It does not always show what is happening during the other hours of the day, especially during sleep. In a healthy pattern, blood pressure usually drops somewhat at night. Doctors often call this the nighttime dip. During sleep, your heart and blood vessels are supposed to get a little rest. But after 60, that pattern may become less reliable. Blood vessels can grow stiffer. Sleep may become lighter and more interrupted. Hormone rhythms may shift. And sometimes, the medicine that worked during the day is not covering the whole night the way you think it is. For some people, blood pressure does not fall at night the way it should. It may stay too high. In some cases, it may even rise. That matters because nighttime blood pressure can reveal risk that a daytime office reading may miss. It can also help explain why some people wake up tired, foggy, or unrefreshed. Those symptoms can come from many causes, so they do not prove a blood pressure problem. But they can be part of the bigger picture. This is why older adults need to pay attention. After 60, the body often adapts quietly. It compensates. It hides trouble well. So relying only on how you feel is not always enough. There are also evening habits that may affect nighttime blood pressure more than many people realize. One is alcohol close to bedtime. It may feel relaxing at first, but later in the night it can disturb sleep, increase awakenings, and in some people affect blood pressure and heart rhythm. If you drink, pay attention to how much, how late, and how you feel the next morning. Another issue is herbal teas and natural products. Natural does not always mean harmless. Some ingredients can raise blood pressure, interfere with medications, or affect the body in ways people do not expect. Reading labels matters, especially if you have a bedtime tea every night. And then there is grapefruit juice. Grapefruit can interfere with the way the body handles certain medications, including some blood pressure medicines. That does not mean it is a problem for everyone, but it can matter depending on what you take, so it is worth asking your doctor or pharmacist. Sleep itself is another major piece. Light sleep, pain, stress, untreated sleep apnea, late caffeine, or frequent trips to the bathroom can all break up sleep. Every interruption can trigger a stress response in the body. Over time, that may matter more than most people think. So what should you do? First, ask a better question at your next appointment. Instead of only asking, "Is my blood pressure okay?" ask, "Do we know what my blood pressure is doing at night?" That one question can change the conversation. Second, ask whether a 24-hour blood pressure monitor makes sense for you. This is often called ambulatory blood pressure monitoring. You wear a cuff for a full day and night while living normally. It gives a much fuller picture than one office reading. It can show whether your blood pressure dips normally during sleep, stays high, or varies more than expected. Third, ask whether your kidneys and overall cardiovascular risk need a closer look. Depending on your history, your doctor may want blood or urine tests to look for early signs that high blood pressure is putting stress on the body. The exact tests should be individualized, but the point is simple. One normal office reading does not always close the case. Now let's talk about timing. Many adults take their blood pressure medicine in the morning because that is how it was first prescribed. But medication timing is not always one size fits all. For some people, timing may affect how well blood pressure is controlled over a full day. That does not mean everyone should switch to bedtime dosing. Some medicines may be a poor fit at night, especially if they increase urination or raise the risk of dizziness and falls. But it does mean the topic is worth discussing. Ask, is the timing of my medicine still right for me? That is a smart question. People also ask about supportive habits, including hibiscus tea. Some research suggests it may modestly support healthy blood pressure in certain adults. But support is the key word. It is not a replacement for medical care, not a cure, and not something to add casually if you already take blood pressure medicine without checking first. So let me make this simple. Tonight, look at your evening routine. Check what you drink before bed. Check whether alcohol is too close to bedtime. Check the labels on any herbal products. Check whether poor sleep has quietly become your normal. Then write down these 3 questions for your doctor. Could my blood pressure be staying high at night? Would a 24-hour monitor help in my case? Is the timing of my medications still the best choice for me? That short list can improve the quality of your next appointment. And I want to say this clearly to those of you in your 60s, 70s, and beyond. You are not being difficult when you ask careful questions. You are being wise. You are protecting your independence, your energy, and the life you want to keep living. The big takeaway is this: daytime blood pressure matters, but it may not be the whole story. What happens during sleep matters too. And if you have never talked with your doctor about nighttime blood pressure, this may be the right time to start. If this video helped you, tell me in the comments whether you have ever worn a 24-hour blood pressure monitor or talked with your doctor about nighttime readings. Your experience could help someone else. And if you know a parent, spouse, sibling, or friend over 60 who would benefit from this, please share this video with them and subscribe for more clear, practical health education. And one important note before we finish. This video is for education only. It is not personal medical advice, and it is not meant to diagnose or treat any condition. Do not stop medications, change doses, start supplements, or change your treatment schedule on your own. Please talk with your own doctor before making health changes, because your history, your prescriptions, and your risks are unique to you.